resetting of the or setting of the sexual maturation or control of the sexual maturation. It is required throughout the life, right, to balance other hormones. So melatonin is like salt. वो नमक की तरह है, वो जिस खाने में जाएगा उस खाने का टेस्ट को पूरा मॉडिफाई कर देगा, और नमक अगर नहीं है खाने के अंदर तो फिर बाकी का खाना टेस्ट ही नहीं आएगा आपको. So melatonin is exactly like that way. It's salt. It's a salt in your whole endocrine system. So every other hormone is affected by melatonin. Its action is modulated by melatonin. So your cortisol, and both ways. Your growth hormone, we know that it's a growth hormone secretochore. Your growth hormone, your sex steroid, your cortisol, everything impacts your melatonin, and everything gets impacted by your melatonin. But what is happening in today's world? We all are living in artificial light. We are not respecting the sun-moon cycle. We are awake till late in the night. In the urban area, people are going to desk in the night where there's all blue light, and blue light is enemy of melatonin. The maximum inhibitory effect of melatonin on melatonin is by the blue light. Blue light, visible blue light. UV light is not visible. So visible blue light, which is there in even in your night lamp you have a blue light. Even in your mobile you will see a blue light. Even in the disc you have the blue light. In the pub you have the blue light. So all that is a suppression of melatonin. So we are TV screen blue light. So we are in a chronic suppression of melatonin. And because of that, other glands, despite of being normal, are not working that optimally. Because all of them need melatonin. For what? Because all the hormones have diurnal variation. And who controls the diurnal variation? Or the circadian rhythm, or a light driven rhythm of the body is melatonin. It is not under control of cortisol or under control of growth hormone. These all are under control of melatonin. So despite we say that pineal gland is rudimentary in human beings, but we cannot say that melatonin is not required by human beings. But the question comes is, can supplementing melatonin can take care of everything? Answer is very difficult to say. It's very vague. The melatonin, the DHEA what you are giving from outside can mimic the DHEA from inside, from your body. Estrogen can mimic estrogen, GH can mimic GH. But with melatonin it is very questionable. Because the timing of the release of melatonin, the influence of light on the release of melatonin, you cannot simply replicate by giving a melatonin supplementation from outside. But because melatonin is required, you have no other option, and lifestyle you cannot change. So we have no option except for instituting or administering melatonin to ourselves and our patients if they are having subclinical multiple endocrine. You feel lot of things are problematic, but reports are normal. There are chances that, and melatonin you don't do any blood test. And sleep issue is with everybody. So before starting benzodiazepines, you may simply start a melatonin, and there are chances that everything is getting reset in the patient. But definitely not to the extent of what would have happened if a patient really changes the lifestyle completely, which is impossible. And we are here not to discuss what is impossible. I cannot, neither you can nor I cannot have our patient to sleep at 8 in the night, not to switch on the light, get out of light completely, work only in the sunlight, daytime, come back like in the ancient age, come back to your cave at night and sleep in the night, and again get up when the first ray of sun is there. Right? We can't. So they will still be living like this way. So what option we have is only to supplement them with melatonin. And day we cannot supplement with melatonin. It's only night time when we can supplement. Melatonin has a sedative property. So we have to tell the patient not to drive after that. And then once we start it, then we follow up the patient and see how the patient is responding. Patient is feeling good, continue that. Patient is still not feeling good, from 3 milligram you can go to 6 milligram. Not beyond that in otherwise healthy individual, but in cancer patient we can go to 10 milligram, 15 milligram and even 20 milligram of melatonin.